Well, hello. This is State Representative Kate Lipper-Garabedian. Thank you for joining me for another Conversations with Kate. I'm thrilled today to be talking with Eileen Durn, the Director of Community Services at MelroseWakefield Healthcare. And you've been there for more than a decade, which is lovely.
Yes.
We're so happy to have you today. It's a really important work that you're leading on. And so I just want to have people have a chance to learn a little bit about you personally, and then also what MelroseWakefield Healthcare is offering in the community right now as we head into the winter. So why don't you give us a little bit of a sense of who you are? What's your professional background and what drives you to do this work?
Sure. Thank you, Representative. I appreciate being here today. As you said, I've been here more than a decade, but actually longer. I was here 17 years prior and then worked for both the state and the federal government for a while, and have worked all different parts of nursing. So I believe the profession of nursing is one that you'll see so different today. We're not really just at the bedside. We're out in the community. We don't always wear the white dress and the hat that we used to in years past. But for me, I started my career knowing very early on that I wanted to help people and wanted to make a difference in their life. And I think it came, my own family, many illnesses helped with my family and felt that that was very satisfying work. But I also grew up with a dad who was a family farmer and grew up in a family farm situation for more than 100 years. And so to me, I really understood that while we were poor in cash on hand, we were rich in that we had land and we also had the ability to grow food and eat. So, and I think as I worked for the federal government in the Department of Agriculture, it became very clear to me that food was probably the most important caveat to building a good health. And I know today there are so many other things, like, for example, early education is such a boon for children to get health and to stay healthy. So those are the kinds of things that brought me to this work. And much of the work I do, people always think, oh, you're retired from nursing. But I'm really not. I'm just doing nursing without the stethoscope necessarily.
Absolutely.
But in many, many ways, yes.
Right. And we've talked a little bit before about the different social determinants of health and food security being such a critical one, educational supports and others. So having your training as a nurse, I'm sure, allows you to sort of work within that framework of considerations about all the cross-sectional components that go into a person's health when you're seeing them, at a bedside or coming forward for a program, right?
Sure. And I think, one of the things that we have always done in healthcare is we talk in our own language, which sometimes is hard for people to understand. So a lot of my staff, there's about 40 of us, they are people who would come from other professions. So they might be an occupational therapist, they might come from education and be an early child teacher. So we try to hire folks that are very diverse in their backgrounds so that we really look and feel like the communities that we serve. And I think the other important parts of those social determinants, whether it's, we say to that patient with diabetes that you need to come for an appointment and they don't have the ability to get on public transportation and get there, or they don't have the food to eat. When we say to them, you need to eat healthy and you need to take this medicine, oftentimes they will take part of their medicine and not all of it. So we're beginning to think in healthcare in a very different way, to recognize that all of those pieces of health need to be considered in order to properly care for patients. And I think you're going to see a change in the insurance. Like for over the last few years, we've been piloting ACOs, or accountable care organizations, in Massachusetts and in other states to see if we focus on those social determinants and what people really need to get healthy, they will do better.
Sure.
And we're seeing that. And now Blue Cross and Tufts and many of the other providers are looking at that as part of contracting going forward. I believe it's 2023 they're really looking at.
Oh, good.
And then looking at things like behavioral health and domestic violence and all the other pieces that go into the health of a person, substance use disorders, all of those are equally as important to good health, is to help folks with whatever that particular issue needs. So it's just really broadening our views.
Right. So it's thinking about all of those intersections and in the performance of healthcare.
Yes.
And also, I think it's really modeled in the work that you're doing at Melrose Wakefield Healthcare, insofar as you're really thinking about integrated services and working with community partners. So maybe we'll segue to that a little bit.
Sure.
And you can share with folks who are listening some of the different programs that you're running, the resources that are available for individuals and their families in this community.
Sure. One of the things I'll start with is our Aging in Balance program. And that program used to be a clinic that we ran where people could come, elders could come and get certain types of illnesses monitored, such as blood pressure. And we are still running those types of clinics, or we will be once we're through the pandemic. But in addition, we've added many, many chronic disease models. So we pick a model. Everything we do in our unit of community services is either evidence-based or evidence-informed because we want to be able to make a difference. So we have chronic disease programs. We have programs that work for falls prevention so that my staff will do these programs. Right now, they're done on Zoom. And then folks who receive that benefit from those programs are actually shown to have an improvement in their risk for falls and for other things. So if you can imagine at a hospital like ours, this is an older community, we certainly see a lot of falls, and falls with serious injury is one of the number one things that we see at Melrose in our emergency room. And so having these fall prevention programs and then working directly with the team inside the hospital to say, how do we prevent falls in the hospital? How do we make sure that that person who falls goes home with the right things? So we used to have our own Lifeline program. We now have what's called a One Source. So we have a relationship with Philips Lifeline, and we can put a falls prevention device on an elder person that will help them to monitor so their family member would be notified if they had a slip or a fall. And these are shown to be very good in helping to prevent falls and to predict when a fall might happen. So we're using technology as well as a lot of new resources.
That's great. My office actually attended a fall prevention webinar of a few weeks ago, and we put out some information about that,
great.
Including sort of the work that, for example, public safety officials can also play a role here, right? With
Yes.
the EMTs coming, helping to figure out why did the fall occur? Is it something in the layout of a home or around a building that we could address, in addition to all the other things that you've referenced as being real important strategies?
And I think that's what the partnerships mean to us, because we recognize we're a small community hospital. We have a great affiliation. We say proudly Wellforce because that means we're affiliated with Tufts Medical Center, their children's hospital, and also Lowell, and a very large home health agency that do amazing work. But as a small part of that organization, financially, we have to look at what we can do ourselves and then what we can do with the community.
Perfect.
So at Melrose, we're a little different. Melrose Wakefield, we do a lot of our own work. So we act very much like a social service agency, or if you can imagine some of the work that maybe you would see in a federally qualified health center. So in Lowell, they do have a federally qualified health center. We don't here. So that we would do some of that work. So we oversee WIC for 12 communities. And WIC is a women's, infants, and children's nutrition program. And what I like about this program is over its 45-year history, it is shown to improve the health of children and pregnant women. And so for us, we tie to the hospital. So we're a baby-friendly hospital. So our parents get the luxury of being able to really learn about breastfeeding and what's best for them and what's best for their baby. And then that same information carries over to our WIC program. We have the first baby cafe ever funded in the country here in Melrose, but we have the first ever funded by WIC in Malden. And that was reaching out to the federal government and saying, we have a great idea. It's working in Melrose. So now we have one in Malden and we have one in Everett. And you mentioned pandemic shift, and that's kind of what we did. I call it the pandemic pivot.
Okay.
Mayor Broder thinks that's a fun term. I think he's hashtagged it for us. But
it's got good alliteration, right?
Yeah, exactly.
Yeah.
And it allowed us to be able to think about, we had less than 2 weeks to be able to change what we were doing to still meet the needs of our community. So quickly, I think Kathy Harlow and her team at the Family Network are the first out of the gate. So they began doing some programs outdoors. So they do something called Nature Explorer. And when we're looking at early child curriculum and STEAM, we're looking at ways, and we're teaching about science and technology and art and engineering and math. And so they're doing programs that are showing children how to take a walk in the woods and see things from a different eye. So they were out doing those kinds of programs and increased their volume of programs multi-times over, whether it was a Zoom class or it was a class done in the outdoor air. We have other programs like WIC where we sent everybody home with a phone through the state and told them that they could do their visits by phone.
Okay.
If you can imagine taking a group of 20 people and sending them all home. So we found that having a meeting daily, right in the middle of the day, to say, are you having trouble? Is there something we can do? We were able to buy through the earmark that you sent us standing desks for those employees. So they were home, they're on a phone, so we were able to buy them headsets and standing desks so that they could spend some of their day standing, other part of the day sitting. So knowing that the legislator was behind us, and that was one of the best things we did with COVID money. Some other things we did was we enhanced our mobile market. We had some federal dollars that we used to increase the number of volunteers. So on every second Saturday of the month, we were having an outdoor mobile market where people could come like a farmer's market and pick up food and really be able to get other information, whether it was no one's favorite month, but colon health month. We would remind them they needed a colonoscopy, whatever else we could do. If we could screen for diabetes, we did. And we had to really look at how we were going to serve the public. We work closely with our Board of Health directors. So in Malden, it's Chris Webb, and we decided that we could do it as a delivery service. So we now pack our groceries outside, 600 bags a month, and then folks like Kathy Harlow delivered those bags to families in need. And Kathy runs a wonderful program, Grandparents Raising Grandchildren, and she's known around the state for that good work. And she delivers those bags to those families. And we do Head Start, we do senior centers. So we're able to kind of incorporate education and community support from elders all the way through to a family with a newborn baby. We really promote safe sleep. That's another important part that we do at the hospital. And because our population, as you know, Melrose and Wakefield is a more affluent population, but as you come down into the other part of the area that you serve, into Malden, we have more immigrants, we have more diversity. They may be living in smaller apartments. They may have folks living with multiple families. So what we've looked at is, for us, I know Winchester Hospital did something with a baby box, and we thought, box is nice, but it could get put on a bureau and forgotten. So we use pack and plays.
Oh, wonderful.
So we get them donated or we buy them.
Okay.
And our finance department at Melrose all wore jeans on Fridays for about a year and donated that money. They paid $5 to wear jeans.
Yes,
Yep.
That's
and
great.
That's kind of how the hospital does. So whatever we need, right now we're going to be doing a Christmas tree event with ABCD, and our hospital will support us in getting us the supplies and materials we need for that. So it allows our staff to feel connected to the people in the community because, as you know, hospitals are full of people having babies, people that are critically ill, and a lot of elders. And the rest of the community is out there, and we need to be out there every day with the rest of the community to protect their health, to be the support for them in times of need, and do what they need from us. So, and all of these services are available very easily.
How would people find out about either whether they need to access some of these programs or resources, or if they would like to volunteer or support them?
Yep, right on our website, we have a section about the community, and you can look there. The other thing that's really helpful to know is every 3 years, a nonprofit hospital like Melrose has to do a needs assessment. So that needs assessment is available to show you what we found, and then we do a community health improvement plan. And based on the pandemic, we let the Attorney General know and the IRS know that we've modified our plan to do more things inside. So for some of our elders, we do coffee and conversation as a phone call. We do, my staff will actually do one-on-one teaching people how to use Zoom, and that's become really popular. And this year we added a new program for families with kids that we thought, well, mom and dad might be working, but not able to fully pay attention while that child is trying to homeschool. So we did something called Safe at Home. So we have a Safe Sitter program, and now we do Safe at Home, which is for the little bit younger child that needs to know what to do if somebody rings the bell. And all of our programs went free. So there's no charge for childbirth classes. There's no charge for any of our classes this year, which we wanted to give to the community and make sure that people weren't worrying about resources, so that they can.
So a couple of things that just resonate with me. You may know I'm a former teacher, and so you think about the school sort of a nexus and a location for community services and connecting people. I think in the same way, a community hospital plays that role.
Yes.
And certainly during the pandemic, when people were more isolated necessarily, having these hubs of activity, whether, even if it was in a remote setting, is so critical. And it makes sense that you all were able to pivot, as you say, and be so successful at continuing and the programs that have been evidence-based and evidence-informed, and then also thinking about how to evolve to meet the needs right now. So it's really tremendous effort from you and your team.
And they're great about, letting me know when something's working well, when something isn't so well. So, for example, this past year we opened an ambulatory surgical center at our campus in Medford. And through that, the state Department of Public Health relies on us to give out a portion of those dollars to the community. So our Community Benefit Advisory Council, which is made up of both leaders at the hospital, other workers like myself, and then members of the community, about half of them are community members, decided that behavioral health was such a huge need that we were able to focus on grants. So we funded 8 organizations, one of which is the Boys and Girls Club in Stoneham Wakefield. We funded the Melrose Y to be able to help elders. We looked at stigma. We looked at 2 different groups, one in Medford and one in Everett, are looking at what is the immigrant response to behavioral health and how do we make it better for them to come in. So this will be 4 years. We'll have money. We're finishing out the first year, and we'll be putting the RFP out very soon for this. And then as you look forward to January, we'll be putting our community health survey out. We do work closely with the other local hospitals, so Leahy BI and also Cambridge Health Alliance kind of come together in our service area. So whatever we collect for data, we share with them, they share with us. And that way we're saying, if Winchester's doing a great asthma program and there doesn't seem to be additional need, then we would focus on something else so that we're all covering the needs, and working together.
So maybe in our last few minutes, we could just talk about where we are right now in the pandemic. So just this morning, the Globe has an article that we're trending in the wrong direction. We're seeing our daily average new cases rise again, which is somewhat expected because of the colder weather and what we've seen with the virus to date. But what are some things, if you put your, you always have your nurse hat on, but, if people are listening in, what can they do personally to help protect themselves? And we also know that we're also interconnected. And so it's not only for your personal health, but what you do can really impact community health as well. So any recommendations?
Sure. So I think the science, believe in the science. The science is accurate and clear. I've been a nurse for a very long time, but I also have staff who work for me that are scientists. And we know that vaccine works, and we encourage people to get the vaccines, get both vaccines if you're getting the Pfizer or the Moderna. We also know that it's really important to kind of break down those myths for people. So if you have a question, we do have people at the hospital available to talk about that. We also want people to remember, don't forget about flu. We've got, we expect to have a heavy flu season as well. And between COVID and flu, we have seen really a volume increase at the hospital. And it's a combination of both breakthrough cases and people who haven't been vaccinated. But if you haven't been vaccinated, you're going to get a much more serious case. Chances having to go on a ventilator, very high. Other types of respiratory support. So I would encourage anybody who has the availability to take the vaccine to do that. Get a booster. I just had mine this week because I'm getting to that older age and I have grandkids that I want to spend time with. And both of my granddaughters who are now eligible will have their vaccine over the next week. And I just think it's critically important when you're out in public, kind of look at the environment you're in. If you're in a big, wide open building with a lot of ventilation, you might be okay. But if you're not, take a turn, go out, walk around, come back. Wear your mask, wear eye covering if you're working very close to somebody. Make sure that you're washing your hands and doing all those things we know protect us, because it really does work. And I'm a perfect example. I'm older. I've been fortunate. I haven't been sick. And again, I had flu last year. I think I was one of the first cases in Massachusetts in August. I would recommend highly that nobody gets it because it's pretty nasty.
It is. I had it when I had my flu shot, but I also was pregnant with our second son, and I contracted it. It can really wear you down. So, so important. Again, not only for your personal health, but for the people around you.
And the other thing, and the other thing is just to make sure that people don't limit other care, because during the time of the pandemic, people would forget and say, I'm due for a mammogram, but do I really want to go? And I go to a wonderful family practitioner who's always top in her practice, Dr. Patty Serino, and she's just written an article about catching breast cancer herself. She would have missed it with her breast self-exam, but it was caught on mammogram. She was able to have her surgery at Melrose. She's doing well. And again, I think those are the things that people forget. Don't, if you've got screening, please do that.
So one last question. Can
Sure.
you remind people for all the programs that you're running, whether they'd like to think about reaching out for some supports or supporting your effort? It's on your website. And what is the website?
MelroseWakefield.org. And there's a great section called In the Community. And you can go there and find out how to donate. We have a great Heroes Fund that we use to bring pizzas and other things to the workers at the hospital when they get tired.
Yes.
And I have to say, just to remind people that, like everyone else, when you go to the hospital, you might wait a little longer today than yesterday because we're just so busy. And to have that patience and kindness, because we all deserve that, right?
Absolutely, Eileen. Thank you so much for being with me today for Conversations with Kate. It's wonderful to have you in the community. My kudos to you, and please extend our well wishes and gratitude to all of the folks working with you and Kathy Harlow, our hometown hero here in Melrose. We're very lucky to be able to have your support, and our community wants to support you as well. So thanks for being here.
Thank you.